Hello, my name is Sunny. I will be doing a presentation on brain and spinal cord cancers along with my partner Lucy Lee. So before we get started, we will be going over what are brain and spinal cord cancers, stats, cause and risk factors, symptoms, treatment options, prevention, and current research. Okay, CNS anatomy. We'll get a chance to look closer at brain and spinal cord cancer and growths, but before discussing the different types of tumors that can occur, we must have a basic understanding of the anatomy. So the brain consists of three parts: the cerebrum, which is responsible for thought process, the cerebellum, which is responsible for coordinating voluntary movements, the brainstem, which connects the brain to the spinal cord. The spinal cord runs through the spinal canal, which runs down through the back half of the vertebrae. The spinal cord and nerves are wrapped in a membrane called the dura mater. This acts as a protective barrier for the spinal cord. These structures are surrounded in water-like fluid called cerebrospinal fluid, also short for CSF, which provides cushion for the delicate brain and spinal tissue. I did provide photos on the side here just for a visual representation.
Hi, my name is Lucy, and I will also be covering parts of the brain and the spinal cord cancers. So in the CNS, there are these glial cells called astrocytes, oligodendrocytes, and ependymal cells. Cancers, primarily the more common ones, arise from these cells. So an astrocyte has a function of nourishing the neurons, and oligodendrocyte provides the myelin sheath for the neurons, and ependymal cells provide CSF in the brain and the spinal cord. So within the CNS, there's also a protective layer called the meninges, where cancers may also arise from these cells.
What is a spinal tumor and where can they grow? A spinal tumor is an abnormal growth of cells within or surrounding your spinal cord or spinal column. Cancerous growths may occur in three different areas of the spine. This includes the first is known as a intradural extramedullary, which are tumors that are located inside the dura sac but outside the spinal cord. Second is known as an extradural. This type of tumor is located outside of your dura. Third is known as intramedullary. This type of tumor grows inside of your spinal cord. I did provide a visual representation on the side here.
Brain tumors are typically named after the cells where they originate from. Some common types of brain tumors include gliomas, meningiomas, and pituitary adenomas. Gliomas arise from the glial cells I mentioned earlier. So an astrocytoma is a tumor that arises from the astrocytes. An oligodendroglioma arises from oligodendrocytes. And ependymos give rise to ependymoma tumors. The meningiomas are tumors that arise anywhere from the meninges within the CNS, and pituitary adenomas arise from the pituitary cells. This is a picture of the brain showing where brain tumors can occur and their location. Again, glial cells make up the central nervous system, and the meninges are the protective covering for the brain and the spinal cord. If tumor cells arise from these glial cells and the meninges, the function of the body may become greatly impacted. So the central nervous system is a very compact system, meaning they don't have room to allow tumor cells to grow. And if tumor cells are growing, they may be pressing against the vital regions of the central nervous system. And this often impacts the person's everyday function. We know that certain parts of the brain control certain functions for the body. So if there's a tumor that is growing in the frontal lobe, a person's personality change may be happening without them knowing. Or if there's a tumor growing and pressing against the temporal lobe, memory may be affected, speech may be affected. We have to remember that location affects the symptoms, and a lot of times people think these are signs of aging, which is not, so it's best to be evaluated. Brain and spinal cord tumors are actually graded based on the tumor cell's likelihood to grow and spread. According to the World Health Organization, CNS tumors are graded from a 1 to a 4. A grade 1 is a slow-growing, benign tumor, often cured with just surgery alone. And a grade 4 is a high-grade, aggressive tumor. Often it's malignant. An example of this type of high-grade tumor is a glioblastoma. Glioblastomas arise from the astrocyte cells, and with a diagnosis of a glioblastoma, patients often have about months to live only.
Okay, now on to risk factors. First, we'll go over genetic conditions. This happens when a person inherits a mutated gene that increases their risk of developing specific cancers. Inherited gene mutations can be passed down from parents to children, unlike the gene mutations that occur randomly in cells throughout a person's life. On to radiation exposure. So, when an individual is exposed to radiation, particularly ionizing radiation, can damage the DNA, potentially leading to uncontrolled cell growth and cancer development. While higher doses of radiation are associated with a greater risk, even low doses can increase the chance of cancer with no clear threshold for a completely safe level. Exposure to toxic chemicals. These chemicals, known as carcinogens, which can damage DNA and lead to uncontrolled cell growth. The risk factors depends on factors like type of chemical, the amount and duration of exposure. Also, primary tumor causes. Scientists aren't sure of the cause of most primary tumors. Some of them may be caused by exposure to cancer-causing chemicals or substances. Tumors can sometimes run in families, so scientists like to think there's a genetic component. Secondary tumor causes. Secondary tumors, also known as metastatic. These tumors that are caused by cancer that form elsewhere in your body and spread through your bloodstream or lymph nodes. Signs and symptoms of brain versus spinal cord. The signs and symptoms of brain and spinal cord tumors vary greatly depending on size, location, rate of growth of the tumor. As the tumor enlarges, it causes increasing compression of the surrounding tissue, leading to a range of neurological changes. First, we'll go over brain tumor signs and symptoms. So, symptoms are often vague at first and may include headaches, often worse in the morning or with activity, nausea, vomiting, weakness on one side of the body, double vision or other visual disturbances, seizures, personality or behavior changes, difficulty with speech or coordination because different parts of the brain control specific functions. Symptoms will depend on the tumor's location. Now on to spinal cord tumors. Spinal cord tumor symptoms often begin with localized or radiating pain and progress to neurological deficits as compression increases. These may include weakness in the arms or legs, sensory changes such as numbness, tingling, or loss of sensation. Also, unsteady gait or difficulty walking, progressive loss of coordination in later stages. Several spine cord compression may include bowel and bladder dysfunction, severe weakness, or even paralysis below the level of the tumor. Prompt detection and treatment are essential to prevent permanent neurological damage and to improve patient outcomes. Okay, on to diagnostic tools. This is used to diagnose the brain and spinal cord cancer. A definitive diagnosis of brain and spinal cord cancer is only done through extensive diagnostic tools. However, it starts with neurological examination to collect as much data as possible, starting with symptoms and how long an individual has been experiencing these symptoms. When indicated, imaging tools are scheduled to assist doctors in confirming a diagnosis of brain or spinal cord cancer. Vital diagnostic imaging may include an MRI, which can be best to visualize the brain and spinal cord tumor size and location. CT scan, which is quick and good for emergencies. It detects bleeding, calcification, and bone changes. Um, Surgical interventions may include a lumbar puncture, which tests cerebral fluid for cancer cells or abnormalities. Also, a biopsy. This is the only definitive test. This confirms the tumor type, grade, and sometimes genetic profile.
Treatment options. So the treatment options for CNS tumors are highly based on the type of tumor, the location, the size of the tumor, and the patient's overall health. These treatment options include surgery, radiation therapy, chemotherapy, and TTFs. So in surgery, surgeons are attempting to remove all of the tumor if possible, or part of the tumor to help alleviate symptoms. Radiation therapy is the use of high energy beams to destroy tumor cells and to stop them from growing. Alongside radiation is chemotherapy drugs, where these drugs are used to kill cancer cells and to stop them from dividing. A type of chemo drug is called TMZ, and TMZ are drugs used to kill glioblastomas. In TTF, it is a non-invasive treatment that uses low electric fields to disrupt cancer cell division. So with the disruption of cancer cell division, the tumor isn't able to multiply and grow. Doctors may also prescribe other drug treatments such as steroids, anti-seizure medications, and hormone replacement therapies. Lifestyle changes. Living with a CNS tumor or being diagnosed with a CNS tumor may require an individual to change their diet, their exercise, and their sleep routine. These changes are necessary to promote an overall well-being. Physical therapies and occupational therapies may also be incorporated to their new lifestyle because of the new limitations that have been imposed after a diagnosis of a CNS tumor. When it comes to their diet, it is recommended to choose nutrient-rich food and to choose a diet that is high in calorie to provide enough energy that the body demands after treatment. Because of the side effects from treatment, it is advised to choose smaller and simple foods. Avoiding greasy food should be a priority because it can cause discomfort. It is also recommended for patients to stay away from foods that can cause foodborne illnesses. Current research and the future directions of CNS cancer. So recent advancements in brain and spinal cord cancer research have focused on understanding risk factors, environmental influence, and the molecular mechanism behind these tumor development. Current efforts are aiming to prevent and to improve early detection, enhance drug delivery to the brain, and develop personalized, targeted treatments. Supportive care is also being expanded. Together, these innovations are paving the way towards a scientific breakthrough in the diagnosis and the treatment of CNS tumors. So in summary, here are some key points we wanted to reiterate. CNS tumors are categorized as either primary tumors or secondary tumors. Brain tumors are named after the cells they originate from, and spinal tumors are based on the location of the tumor to the spinal cord. Depending on the size and the location of the tumor, some symptoms are more prominent than others. Certain risk factor increases an individual's chance of developing a CNS tumor. Therefore, early detection is key to starting treatment early. Being diagnosed with a CNS tumor is often life-changing, and continued research is critical to improve the outcome and the quality of life to those that are affected by CNS tumors.